Federal agencies are trying to change the rules of a program that offers hospitals drugs at a discounted price. The Maine Hospital Association recently filed a lawsuit to prevent that from happening. News Center Maine's Pearl Small takes a look at the potential impact the changes could have.
It's no different than going into a store where it says 30% off a particular product. You get the 30% off at the moment you buy the product.
Jeffrey Austin, Vice President of Government Affairs at the Maine Hospital Association, says that's how the 340B drug pricing program has worked for about 30 years. To help subsidize nonprofit and public hospitals, drug manufacturers have to give them a 30% discount on what they'd typically charge for some of the most expensive drugs on the market.
We have limited amounts of money, whereas the manufacturers have pretty good profit margins.
But leaders in the federal government and Health Resources and Services Administration who oversee this program announced they are changing the rules. Hospitals will now have to front the full price of the drugs first, then ask for a rebate from the manufacturer later.
We fixed your broken leg. We can't take that back.
Yeah.
So the money is spent by us, you've received the care, and now we've got to chase the carrier for payment. And they have a financial incentive to delay, to deny.
Austin says this will make refunds less likely, but it also means hospitals will have to spend millions on administrative fees, paying agents to go back and forth with manufacturers. Head of the Health Resources and Services Administration, Tom Engels, called the announcement a way to, quote, address concerns about the program and to ensure it operates with, quote, accountability and transparency. But Austin says the government already requires participating hospitals to keep very detailed records of where the drugs are going, and they're frequently subject to audits.
Nobody's going to lie. You lie, you get thrown out of the program. This is millions of dollars.
The MHA, which represents 26 Maine hospitals that benefit from the program, has joined a lawsuit against the federal agencies that made these changes, accusing them of rewriting rules to the program without getting the required approval from Congress. They're also asking for a temporary restraining order to prevent the changes from going into effect until a judge has ruled.
I think the biggest concern we have for patients is, are there some drugs that are so expensive that we simply can't afford to front the cost?
If that happens, Austin says it could turn into a drug accessibility issue for patients across the state. In Augusta, Pearl Small, News Center, Maine.